Hi, everyone. I'm Leo Rutherford. I'm very glad to be here with you all today. I'm a PhD candidate at the University of Victoria in British Columbia, and the title of my presentation today is Trans Community Determined Surgical Outcome Research, Ideas and Ideals. I'm joining you today from Nanaimo. It is the land of the Nanaimo First Nation and the Coast Salish people, and I'm excited to be giving you this presentation. Just briefly, I'll share that this research is supported by the Canadian Institute for Health Research, the Strategy for Patient-Oriented Research, previously through an award from the BC Support Unit. And our partners and sponsors are the Community-Based Research Center and Transcare BC. Through this presentation today, I'll be talking to you a little bit about my dissertation project and a little bit about current literature and other research. So an overview of the day here. I'll just be giving you a quick introduction about current research on the topic and what surgical outcome standards are, and an introduction to the surgical procedures I'm describing, which will be brief, but enough to get you through the rest of the presentation. I'll then give a bit of background about how currently outcomes are determined in research before going on to the project I mentioned that is my dissertation, which is called Progress. And I'll be speaking about what we're doing differently and how it's similar or different from the current research on the topic. The last section will focus on future ideas and ideals, which will include knowledge translation, how our research will benefit the community, and some hopes for the future on research for this topic. Before I begin to talk too much about the surgical procedures and the outcomes of these that are in literature and as well as my ongoing research, I just wanted to state that whereas I'm talking about surgeries that some trans people have on their genitals, trans and non-binary people are diverse and not everyone wants the same things for their bodies. So some trans people take hormones or have surgeries, some do not. For the particular procedures I'm describing today, only a small portion of trans masculine people have these surgeries. So these surgeries are for people who are assigned female at birth and identify as trans, non-binary, genderqueer, two-spirit, anything sort of under that umbrella. I'll give you next an introduction to phalloplasty and metoidioplasty. So big name, complicated surgeries. At the end of the day, what these are two gender-affirming surgeries that, as I mentioned, are used for trans men and non-binary people. They each are a little bit different, but primarily the goal for both of them is to masculinize the genitals. So people can choose a number of different procedures. Phalloplasty, for instance, uses a grafted site and additional donor tissue, whereas metoidioplasty uses tissue that already exists in the genital region. So they both form a more masculine-looking genitals. We will call it a penis for this presentation. Phalloplasty and metoidioplasty can both have additional procedures, such as ones to lengthen the urethra so that the person can urinate from their penis. They can also create a scrotum and testes or testy-like items for people, as well as erectile aids so that people can have penetrative sex. They're very complicated procedures, and I could spend a very long time talking to you about what exactly happens in them, but primarily what we're interested for this talk and for my research is more about the outcomes of the procedure rather than how the procedures themselves are actually conducted. So next I'll give you background then. How are outcomes determined in current literature? So currently, surgical outcomes are items that are historically determined by surgeons. If you're not familiar with the idea of a surgical outcome, it's really anything, any characteristic that changes as a result of a surgical intervention. So historically, a surgery occurs and a surgeon notes changes that happen for that patient in their medical record and through clinical exams. And these are traditionally what we refer to as surgical outcomes. Phalloplasty and metoidioplasty, more specifically, have a benchmark set of ideal results, which surgeons determined they should be meeting with their surgeries. These include that the penis has a satisfactory appearance. The person has the ability to urinate, they're able to have penetrative sex, and that they have erotic and tactile sensation. So given these set of benchmarks, surgeons have focused on these in their literature and in the research that they conduct. In addition, surgical complication rates are often reported as complications are quite high for especially the urologic aspects of these procedures. So these have been the outcomes that primarily surgeons have looked at and continue to address in current literature. There are a number of limitations to this current research, however. Overall, they're small sample sizes, and considering surgeons are the researchers, they're typically drawing on patients from their practice and their surgical center rather than conducting research across the entirety of the population of people who have had these surgeries. So these are all convenient samples, so we can't really make inferences about the whole population, and we can't really compare across surgical centers because the same measures aren't necessarily being used to look at outcomes across these centers. Most data then is also collected via clinical exams. So a patient comes in for a routine follow-up and the surgeon is able to note any challenges they're having, whether they're able to urinate, what complications they have had, and ask questions about sensation and sex life, that sort of thing. One of the biggest areas that is lacking in current literature, and part of the reason I'm undertaking the research that I am, is that there is a significant lack of patient voices in determining what outcomes should be measured. In current literature, there's honestly not many examples of patients determining what outcomes are important to them and that being reflected in the research that's being conducted. So patient input is also lacking in research design and in the knowledge translation that's coming out from the research. All of this to lead up to talking about my dissertation project and how this is different from the traditional ways of determining outcomes for these procedures. The project is called PROGRESS for phalloplasty and metoidioplasty. PROGRESS is an acronym which stands for Patient Reported Outcomes of Genital Reconstruction and Experiences of Surgical Satisfaction. So compared to the way of determining outcomes that I mentioned, which was primarily by surgeons based on their benchmark set of ideals, we're doing things differently. So I am a PhD candidate and I'm supervised by 3 researchers, 2 of whom are trans and 1 is cis. Those were all community members. However, those of us who are involved in designing this research more intimately are all both trans community members and people who have had 1 or more of these surgical procedures. So we're people with lived experience of these of this surgical procedure. And we're making decisions collaboratively. So what we've been doing over the last, I'd say, year-long period is having meetings quite regularly to determine what topics are important in our research project, how to approach research design, and how to translate knowledge that is relevant and important for our community. So we're prioritizing patient-identified outcomes for inclusion in our research. Our early meetings were basically us going through a list of what are the most important topics that we think are important for patients, that we think our community members need to know about these surgical procedures and about their outcomes. From there, we went on to start designing some survey items and some questions that we thought would capture this information, or look to existing measures or work that other people have done to adapt their questionnaires or their survey items. In doing all of this, we've identified a number of novel topics that we think are important for patients and for our community, but have not yet been addressed in current literature. Because of that, our survey will include a breadth and depth of topics that are not currently addressed in the literature, including things like patient preparedness for surgery. So this is like, how do people access information about surgery and what is useful for them while they're preparing? What is their informed consent process like? What is their readiness for surgery assessments like? And how much knowledge do they have about surgery? And how is this related to their overall experience and how they feel about the process? We've identified that doctor-patient relationships are important to patients and probably to the community. And what is important in choosing a surgeon, and how do people in the community navigate choosing a surgeon if they have that option based on what they know about that doctor, and how is that relevant to their care and to their outcomes of their surgery? Postoperative depression is an experience of depression that's unique to someone who has undergone a major surgical procedure. It is sometimes related to anesthesia. Sometimes it's related to the stress of undergoing that surgical experience. and is known by community members to be quite prevalent, yet research doesn't really talk about this as of yet as an outcome or a potential challenge that people have as they're recovering from surgery. Some research has previously talked a bit about changes in sexuality or things like sexual satisfaction that people might have as a result of their surgery. We've drafted some questions that are pre-post sort of measures, asking people what their sex life was before they had surgery and what sort of things change and how they feel about those changes, so that we can get a more nuanced understanding of what actually changes as a result of this, and therefore, like, what is the outcome for people who have these procedures. Relatedly, we asked some questions in the survey about dysphoria and euphoria. So dysphoria is a sense of like unease or uncomfortability with certain aspects of your body. Likely that is something that changes for a lot of people when they undergo a needed gender affirming surgery. So we're interested to see how people will say that this surgical procedure impacts their sense of dysphoria, and alternatively, their feelings of euphoria, which is joy or happiness with their whole body or an aspect of their body. Dysphoria is something that's commonly talked about in relationship to trans experiences, but euphoria less so. We think that community members who have these surgeries come to experience a lot of joy in their bodies afterwards and are interested to capture that in this research. Another area that we've addressed as important and included in our survey is genital self-image. So there are a number of scales and measures that are used for cisgender or non-transgender men, which reflect how people feel about their genitals, whether they feel generally happy about them, satisfied with them, comfortable with their bodies and sexual encounters. So we've adapted and included a couple of measures about genital self-image to see how patients who've undergone these procedures now feel about their genitals compared to how they felt before they had surgery. These are all this is not the entirety of the survey. These are just some topic areas, but these are all important topics that we think should be included in research and outcome research about these topics, but have not really been addressed previously. Relatedly, our knowledge translation process will be different from what is traditional. So surgeons have created knowledge about outcomes research and primarily use conferences and academic presentations as their knowledge translation. Given this is a patient-oriented and community-based project, we feel it's very important to get information back into the hands of community as quickly as possible. And we'll be using some novel approaches to doing that, which I hope become more common in knowledge translation going forward and other types of research that are similar. So this includes infographics that we can share on our website and on social media, short videos or vlogs where we talk about our findings and their implications, a workshop to educate future patients about what they might expect and what outcomes they might have, a report for surgeons and doctors or other providers that might give them information that's useful for their patients or just their practice in general, community reports based on all of the data, and if we're funded for an additional grant in the future, a data dashboard with an anonymized portion of the data. This is essentially a website that community members can go to visualize the data that we have collected and take a look at how people generally have responded to certain questions in the survey and quickly get a sense of what information we've collected and how that might be applicable to them. So in the future, I hope that more research is tending towards more inclusion of patients in this type of outcome research. I will be continuing my work, which will robustly include patients. And I hope that through the BC Support Unit and other initiatives for patient-oriented research, that surgeons and other people who conduct this type of research recognize the importance of including patients in either recognizing what are important outcomes for this population, or in their study design or in their knowledge translation activities. In an ideal world, I foresee trans patients leading research projects on these topics and initiatives to support that. But at the very least, I would hope in the future that projects can continue to center the voice and experiences of our communities rather than not including patients and trans community members in that process. Our website is currently in development and our survey will be out in the next month or two. So feel free to bookmark our website here for future visits. This is a snapshot on the left of what it will look like when you visit. Thanks so much for your time today. I really appreciate you taking the time to be with me. If you have any questions, you can email me or email the study, the progress study at gmail.com.